P wave, the QRS complex, and the T wave. So the P wave, the QRS complex, and the T wave. 3 different components. These are the 3 main components of an EKG. Now, whenever we do look at an EKG, there are 4 things we're looking for. 2 of them go with the atria and 2 of them go with the ventricles. And both of those things that go with each are the same. So instead of doing it like this, we're looking for depolarization and repolarization of both the atria and both the ventricle. So not both atria and both ventricles, but we are looking for the depolarization, the point of depolarization for the atria and the point of repolarization for the atria as well as the ventricles. So the 2 things that we look for the atria are the same 2 things that we look for the ventricles. Now the P wave is atrial depolarization. So the P wave actually marks off one of those things. And since we're looking for 2 things with the atria and 2 things with the ventricles, we are looking for a total of 4. But the P wave is atrial depolarization. That checks off 1. Now this QRS complex represents 2 things. And going by the process of elimination, if we had to logically imply what the QRS complex would hold, it would be atrial repolarization, because the atria have already depolarized, so they need to repolarize, and that would be correct, and ventricular depolarization. We have to depolarize before we repolarize. That's one principle here. But the other principle here is that the atria must go before the ventricles. The atria must go before the ventricles so that the atria help to completely fill the ventricles with blood. So the atria depolarize, and this atrial depolarization is atrial systole, which is correlated with stage 5 of the cardiac cycle and is active filling. And active filling occurs to make sure that the ventricles are filled up to their max potential before the ventricles actually work to inject blood. So the atria are going to contract to fill the ventricles. Then the ventricles are going to contract or depolarize to move that blood to the lungs or to the body. And now, since we have 3 of the 4 things, by process of elimination, that leaves us with ventricular repolarization. So the T wave represents ventricular repolarization. The T wave is correlated with stage 2 of the cardiac cycle. The QRS complex is associated with stage 1, and the P wave with stage 5.